Hello, everyone, and welcome to this week's Birth and Baby Talk. If you've been following our Instagram, you know I have been excited about this episode since January, Michiko, when we first started talking about this. This is an area I have been passionate about talking about for years and maybe not taking my own advice so much, which I think a lot of moms are guilty of. Michiko, we've been referring to you for years. For anyone who hasn't been following along, Michiko is a pelvic floor physiotherapist. We love her to death, and she is who we refer all of our clients to. So,
yes, thank you.
Why don't you start off, and why don't you tell us sort of who you are and what got you into pelvic floor physiotherapy in particular, a little bit about your practice and how you work.
Yeah, totally. So I'm Michiko. My pronouns are she and her. So, I am a registered physiotherapist. I've been working in this field for about 15 years in terms of physiotherapy, but I became a pelvic health physiotherapist because of my own personal experience and journey through pelvic pain and sexual dysfunction, pelvic dysfunction, and, having postpartum difficulties. And I really saw that there was a benefit in pelvic health physiotherapy, getting trained myself. So, I thought, wow, like if I could relieve my pain and relieve all my incontinence, then why can't I help other people? So I became a pelvic health physiotherapist myself. And now I own my own clinic here in Liberty Village, and I'm helping a lot of people, which is so fantastic.
And that clinic is new. That just happened in the last few months. So congratulations.
Yes. Oh, thank you so much.
And again, I'm going to send everybody back to our Instagram because Michiko has the most gorgeous mural on the wall of the office that I am totally in love with, and I am definitely taking a picture with when I'm there.
Totally.
So I'm going to jump right in because you mentioned, I think, what a lot of us have going on in the background, but nobody wants to talk about it because talking about urinary incontinence or fecal incontinence, talking about pain during intercourse, these are not, dinner table conversations, generally speaking.
No.
So a lot of women suffer in silence. And I actually think back to my mom and our mother's generation, and they were told to either live with it or get a bladder sling surgery. Those were sort of the two options for our mother's generation.
Yeah.
Obviously now there's more options available that we can look at. So when people are coming to you, especially just for our audience, pregnant and postpartum folks who are looking to, they're worried about pushing, they're worried about maintaining their pelvic floor health throughout their pregnancy, but also on the postpartum side, they're coming to you with a sort of huge array of challenges. You want to talk about some of the most common conditions and challenges you work with and you treat?
Yeah. So, you know what? It's important to actually note here that also I see prenatally as well in terms of like just in preparation for everything. But, I see a lot of individuals who come with tailbone pain, tailbone trauma, after delivery. They come also with pubic bone symphysis, like pain. They come with low back pain. Sometimes, urinary incontinence they'll come with, but also urgency. And a lot of people, yes, for sure, painful intercourse. Any kind of intimacy sometimes is a little bit more uncomfortable. So we talk about more on a biopsychosocial model, that's what they call it, approach, where we talk about not just the biological things, the factors that are happening, but all the conditions that we look at are, I would say it's not just a physical thing that we treat, like we have to treat the whole person. So lots of things that we consider when we're treating individuals that are both pregnant as well as postpartum.
Well, that's actually something I've been pushing a little bit the last few days is this idea of pelvic physiotherapy as self-care for pregnant and postpartum individuals, because I know that I am like the worst person ever. I will book a doctor's appointment for my kid at the drop of a hat. And I'm like, oh yeah, I need that referral to that specialist. Maybe I'll get to it next month. So, it really is taking care of ourselves as parents and as individuals. Sort of vital in being parents because our body and our emotions are a huge piece of how we parent. And I know that, we talk a lot, especially in doula work, about how your emotional state can impact your physical state and vice versa. So that sort of all rolls into a lot of what we talk about with our clients already, that if you're stressed, if you're anxious, all of these things, it's going to exacerbate some of these problems, and having these problems and challenges can lower your mood and make you anxious.
Right. And your pain can increase. Like, there's a lot of things. It's not just, the physical factor that people come in for. I think that's what I want to stress is that, sure, like you might come with coccyx pain, like with their tailbone pain, and I could definitely do a rectal examination and I can actually help you and traction the coccyx. But really, there's much more than that. There's much, much more that we need to consider.
Okay, let's talk about that, because that is probably like the number one thing that everybody watching this is like, you're gonna do a what now? So honestly, I think this is the piece that makes everybody super uncomfortable and kind of hesitant to go in. We don't talk about rectal exams on a regular basis.
So I mean, like, honestly, like, I think maybe we can talk about first, like, what to expect.
Sure,
like, when you come. So you know what, when you come, it's all at your pace. So whatever you're comfortable with, we're going to do. So I don't ever ask for an internal examination to be, I never force anything. Obviously, it's all from your consent to provide your consent for internal, rectal, or vaginal. With the vaginal examination or a rectal, it should not be painful. Like, I have this thing, and I always say it's not beyond the yellow face. So you're not going to be experiencing excruciating pain. It's therapy. It's supposed to be comfortable and welcoming and gentle. So that's what I do. Any kind of rectal examination. People ask me all the time. They're like, but pregnant ladies or pregnant people, birthing people, they come here, and when I release their coccyx, their tailbone from the rectal examination, they're like, whoa, it feels so good. It's like a relaxing, because the tension in that pelvic floor is totally released as soon as we do it. So of course there's other things that we do, but a lot of the tailbone release is a huge benefit to pregnant and birthing people.
I'm like having flashbacks to tailbone. Well, with my second, I had pubic symphysis dysfunction. So I had a lot of pelvic pain through that entire pregnancy. And it's the support belts and the shoulder straps for them. And it was like belting myself into this contraption every day just so I could get up. And in my case, it actually ended up causing like irritable uterus and a shortening cervix early. And so, I mean, in retrospect, maybe I should have seen you 5 years ago, but.
But like, that's the thing. There are so many tools to help everyone, but a personalized care is so important. And that's why I would say, go see a pelvic health physiotherapist or a care provider and ensure that you get, first get a 15-minute free chat and just make sure that you're the right fit. And then go in and actually talk to the individual and get a full assessment done before you start using any kind of tools and a support belts or anything of that sort.
Hey, listen, 5.5 years ago, that was the internet's advice, was order this, and I don't even remember the name of it now, but it was like this specific one that had the straps and the shoulder straps. And it was literally like belting myself into a contraption. It helped. It just very helped. So it's really good. And I know we sort of bounce back and forth between prenatal and postpartum here, but that's really good information. A lot of individuals experience, pelvic girdle pain and tailbone pain and pubis pain, lightning crotch, all the fabulous parts of pregnancy that we all super look forward to. And so these are all sort of things that you can help with.
Yeah, definitely. I can. But I think what I usually do is I really look at the central nervous system as well. So I'm like looking at how the body, the brain, and all that kind of stuff works. It's not just the muscles and the joints. It's like, you got to look at everything else around, because the pelvic floor physiotherapist is essentially looking at not just the pelvic floor itself and the actually affected tissue, but they're looking at the diaphragm, they're looking at the abdominals, the back, the legs, like everything should be looked at. And you know, how sensitive you are as well. Like, is the nervous system really, really overcharged, and are you stressed out? Like, there's a lot of things that you got to look at, and that's what I treat for sure. Yeah.
That's amazing, because I know for anyone who doesn't know my story, I had a very long sort of road to getting a diagnosis of an autoimmune condition, and nobody looks at the whole picture. You know, when I lucked into some really amazing care providers, my chiropractor, my massage therapist, are phenomenal and are both very sort of whole person treatment oriented.
Exactly.
But it's not something you find if you go to your OB with a problem around prolapse. You know, if you make an appointment with your OBGYN and you say, I think I have some prolapse happening, they're not sort of assessing the abdominal core or your diaphragm or your hips or how any of those are interacting. So the fact that you're looking at that sort of whole person is huge, because to me, and I mean, maybe I'm wrong, but this feels to me more like a long-term approach as opposed to a quick, immediate.
Yeah. And you know what, like, I should say, like, our initial meeting is like an hour long. Like, it's in depth. So it's not just like a, hey, you know what, you have a prolapse, goodbye now. It's not like that. So, you know, you come in and I actually create, I always create an initial assessment report to I send to your caregiver, whether it's your doula or your midwife or your OBGYN. Like, I always write up a letter of what I saw, and then I make sure that you get a comprehensive care so that everyone knows what's going on. But also, I really think it's important to note here that, you know, I think that when you go to an OBGYN or whatever, I also think that perhaps you're not jotting down all the things that are being told. So it's hard to remember everything too, right? So a comprehensive care is also emailing. So I always follow up with an email saying, these are all the exercises, these are all the things we talked about. It's okay, you don't have to remember everything, you know?
I'm sure your prenatal patients really appreciate
Oh my gosh. It's a lot of information. So yeah.
I remember being pregnant and I'd like have questions for my OB and I'd put them on my phone so I remembered them. And then I'd get to the elevator at the end of my appointment and went, like, I forgot I had questions on my phone.
There's so many, right? So yeah, it's like too much.
So that's awesome. So everybody sort of, they come in, you know, this assessment, the conversation, I'm sure just like when everybody meets a new practitioner. So, you know, you go through medical history. I'm sure there's paperwork, all of that stuff is sort of the initial. And then as you said, you know, with consent and to everybody's comfort level, you're doing a physical assessment as well. And then it sounds like you sort of create a treatment plan, just like if I was going to physio for a knee injury.
Yeah, and it's very, very personalized. So, you know, it depends on whether, like, for example, like if you come and let's say we're just strictly looking at the pelvic floor, and it depends on the state of your muscles that you come in with. So are they tight and short? Perhaps they are. Then you need to lengthen them. So I'm going to give you exercise to actually lengthen it and relax the muscles. Then, well, maybe they're really weak and lengthened. Then I need to give you a strengthening program. So it's very, very different. Like it depends on what the state is when you come in and see me. Definitely.
I'm actually really glad you brought that up because this was something a few years ago that I found out, and it was really new information to me, even as a doula, which is maybe a little embarrassing. But I think everybody has this perception that after having a baby, everything is stretched out and sort of like flopping in the wind. But I like it sounds to me, and from what I've learned, is a lot of people actually almost contract and tighten. A lot of that sort of sexual dysfunction, especially, comes from muscles that can't release and can't relax.
Yeah. So it depends. Like there's like things like, for example, if I've seen often, not necessarily all, but if you, for example, have a C-section, then what happens with the scar and the adhesions that happen, it actually pulls on the abdomen connective tissue and everything, all those things could kind of tighten up. And then your pelvic floor also starts to tighten up too, or grip. But also, you could have pain postpartum. That could also create a painful, vicious cycle of tightening short muscles. So, there's this, a long time ago, I think a lot of people thought that, it's just weak muscles and lengthened muscles after delivery, but it's not necessarily that. And you should get assessed before you start doing Kegels, for sure.
I would say, and that's exactly why you're not supposed to just start doing Kegels.
Yeah, you can't. No, definitely not. It depends on what you need. And Kegels is just like any exercise out there. You don't do it unless you actually, really, your body actually needs it, right? So, yeah.
Yeah, and I definitely think that even in the last sort of 10 years, a lot of people, that's what they hear is, well, do Kegels. Do X number of Kegels a day during your pregnancy and after your pregnancy, and that'll take care of all of this. But in some cases, or in some cases at least, it might be causing more of a problem than fixing it.
Yeah. And you might need an actual release of those muscles rather than, and scar management to make the tissues more malleable. Like, all these things might need to be done instead of actually doing Kegels and making them shorter and shorter and grippier and grippier. Like, it's probably not a good thing. Yeah.
Yeah, and it really strikes me, especially as we've been talking today, I've seen this advent in the last sort of year and a half of all of these online pelvic floor programs, recovery, physical therapy from your home. And it's really just following a series of videos. But this comes back to why it's so important to at least see initially a qualified practitioner to figure out where you fit in within all of these needs before you. I guess it's like the warning on the old, I'm thinking like Tybo, so I just totally aged myself. But like, do an exercise program without consulting with your physician. Yeah. It's the same thing.
Yeah, absolutely. Totally the same thing. I mean, like, just like a physician, like, or anyone would say, these are contraindications to doing an exercise program. It's just the same thing. Like, you need to get assessed first, figure out what state you're at, figure out what your baseline is, and then go from there. Or else, what's the point of doing it, So, yeah, that's just my opinion. This is how I think, too. Yeah.
Which is fantastic, and part of the reason we refer to you and think you're so we obviously, as doulas, we believe in sort of whole person care, and we know that that's whenever we send someone to you. So that's always a reassurance for us. Now, I know that the line at the bottom of our screen is sort of saying, are you experiencing any symptoms of pelvic floor dysfunction? We talked a little bit about sort of incontinence and pain, that sort of thing. Are there any other, especially maybe prenatally, symptoms that people can be, because we talked a bit more about postpartum, prenatally especially, like, what should people be aware of that might necessitate a need to start earlier rather than late? I mean, obviously, I think starting earlier rather than later is probably always good.
Yeah.
Just like I, 5.5 years ago had SPD, and which is pubic dysfunction for anyone who isn't in on the acronyms. So obviously, if I was now experiencing that, I would know to book myself in right away. But what are maybe more subtle things that people are experiencing in bigger problems down the road?
Yeah, like, I think a lot of people just say, oh, low back pain, that's like kind of just normal, during pregnancy. But maybe go check it out. Maybe there's a little bit of something that you could help you, and some pelvic health physiotherapists can support you with. If there's any kind of like inner thigh tightness, referred pain to the vulvar area, like things like that, maybe you want to go check it out. There's a lot of people come with butt cheek pain too, and so
I forgot about that.
So that a lot of people come to talk to me about breathing. So that's a huge thing too, because I do a lot of breathing training, like how to do deep breathing, and we talk about like breathing through the back and the sides of the ribs, because the baby just grows, so it's hard to breathe from the belly breathing, right? So we talk about a lot of different kinds of breathing, how to move the pelvic floor with the breath, and all that kind of stuff. So it's not. I would say that if you have difficulty and challenges, and even if something's kind of off and you think it's off, you should probably go see a pelvic health physiotherapist if you're interested.
For sure. And then actually, I'm going to switch right back over to postpartum, and we're going to go back and forth. It's actually, and I guess it's sort of a combination of a lot of them. And this is another one that I think people don't talk about very much, is scar tissue from cesareans, but also from episiotomies and tears, because that can create issues within the vaginal and the perineum area. And definitely. So when people have scars or they know that they've had these procedures done, is there a different approach? What does that look like?
Yeah, so, you know, there's many different kinds of approaches. So I would say that, you know, a lot of people, well, approaches within techniques. So doing scar management techniques, whether it's desensitization, so it's like hypersensitive, you know, it doesn't want to be touched by anything. So we do a desensitization program where we use like a wet towel to like start doing, or soft finger touches, and then start doing rougher materials. And then eventually we also do kind of massages for the perineum. And then we actually do a lot of stretches, like internal kind of stretches, in order to do ensure that the elasticity and the malleability of the tissue comes back. So, but I would like to say, Meaghan, going back to prenatal, I would do
Oh, we're just about back and forth. It works.
I know. We're like, you know what? I actually do about at 36 to 38 weeks pregnancy, I start perineal massages and like actual stretches as well. And I teach that to patients as well as their partners, just to make sure that it's done so that, the tissue is more softer and stretchier. Yeah.
And I'm definitely going to tell everybody that if you're going to do perineal massages, please go see Michiko first. I actually stopped recommending perineal massage years ago with my client, because too many of them were doing it incorrectly and were actually causing harm. They were damaging the perineal tissue. It was making them more likely to tears and infections and that kind of thing down the road when they did get birth. So I was get like, no, I don't recommend it. You don't need it. But obviously, if a qualified practitioner is telling you how to do it and showing you how to do it, it's a different story. Right. So for all of you who are watching, please, please, please do not just grab a bottle of olive oil and go at it.
Yeah.
Go with somebody first. Obviously, we recommend Michiko, but it's such a common thing you see on the internet and in mom groups and that kind of thing, birthing groups. And it's obviously something that needs to be done with care, because it can damage, and you don't want to do that right before you have a baby.
Well,
now,
No,
sorry, what were you gonna say?
No, that's it. Yeah. Go ahead, Meaghan.
I know we've talked about a lot of stuff. I want to talk about 2 weeks from now. Now, we did just figure out a wrinkle that when we planned all of this, masks were not a part of everyday living. So we're going to need to troubleshoot that a little bit, because obviously we want everyone to be able to hear what's going on. But when I come in 2 weeks, I think we'll probably do the paperwork, not live. But I walk through the door, I do all the paperwork, I go into the exam room. What are the first 10 minutes like? What is the first what's an hour like?
Okay, so you'll sit down, and you know what, first of all, everything's disinfected. So, and then you sit down, and
in the age of COVID is everything has been sanitized within an inch of its life.
Yeah. And you know, I actually used to work in infection control in the hospital, so I'm like super like anal about it, which is no pun intended. But so yeah, and we sit and we really just talk, and I want to know what your story is. I want to know what your birth plan is. I want to know what has happened during delivery, if it's postpartum, what your experience was. You know, did you feel supported? All those kinds of things. Like, everything around you is so important. So I'm going to talk to you and ask you a lot of questions. And even though you filled out my intake form, I will really, really ask you deep questions such as, how do you feel today? Or, you know, what does better mean to you? Or, you know, like all these kinds of things. So, and then we establish really functional goals. So I say, you know, what do you want out of this hour? And what do you want to do with like all the information that you receive with me? So what do you want to achieve? Let's make it realistic. Let's make it achievable. Let's make them smart. So we set some goals out, and then we really go at it, and we just say, okay, today is a lot of education. First session is always a lot of education. I think knowledge is power. So I really want my clients to really understand what's happening to their body, what's going to happen to their body, and how they will recover. So we talk a lot about that. And then after we do a physical assessment, but it doesn't have to be internal. It can be just external. And then and then I give you a treatment program, pretty much what is appropriate for you specifically. Yeah. So first 10 minutes, lots of talking.
I mean, it's me in 2 weeks, so I feel like that maybe won't be a problem. Now, before we hop off, because I know your time is valuable, we wanted to highlight, because this is another big reason why we refer to you, is the inclusivity of your practice. So you don't just treat cisgender women.
No, absolutely not. I like to make my service very safe, very comfortable, welcoming, and inclusive. I from the get-go do my intake form, and from the start it would say, what is your sex assigned at birth, but what is your gender identity, and what are your pronouns? So I respect what you identify as, and you can come in and I will definitely apply your pronouns appropriately, and we will talk about your partners or anyone who is involved in your care, and I will respect what your choices are. I do not push anything, and like everything is very, very we just talk about any kind of like anything in terms of, I really talk about, I guess, what object is going in where. I'm not talking about, like the penis in the vagina. That's not what I talk about. So, like all the sex talk, anything too, like everything is very inclusive. Very
wonderful. We work the same way. So it's always important to us to be referring to practitioners who sort of have that set of values as well. And this is actually, I learned this when we started talking about this episode.
Yeah.
In my mind, pelvic floor physiotherapy was for people with uteruses. Uteri.
No.
That's a really common perception, though. And I know that obviously we're focusing more on prenatal and postpartum right now, but yours is a service that can help men or trans who have, don't have a vagina or a uterus, a cervix, those pieces. So you're really able to help fully across the spectrum.
Yeah, so I've done my post-grad specialization also in the trans and gender diverse population. I went to New York to do this as well, and I've done some education in UK as well. So I've done all genders, all bodies, all sexes on birth. Everyone is welcome here. And I think there's this misconception that males don't have a pelvis or something, but they do, and they have concerns as well. So
when you put it like that, it makes so much sense. Assigned men at birth have a pelvis, therefore they can benefit from pelvic floor physiotherapy.
And you know what? I would say that 40% of my clients are probably people with penises.
Awesome. Again, I wouldn't have thought that until, the last 6 months. We're always learning, right? So it really does make sense that men also have pelvises and can benefit from this. But anyways, Michiko, thank you so much. Obviously, everybody who's watched today, please come back in 2 weeks and literally watch. Everything will be PG, obviously, because I don't want to. But I'm going to take the mystery out of it. I'm going to, go through this and do it so that everybody knows what it looks like and what to expect. And I'm a doula. I've had 2 kids. I have no shyness. No issues with internal exams. I'm up for all of it so that any of you who are watching can sort of experience it a little bit vicariously, see what it's like, get some real-time feedback on the experience so that it takes away some of that mystery. And I am so excited to do that. This is probably 5 years overdue.
And I'm so excited, Meaghan. So excited.
I haven't seen you in probably 2 months. So I feel like I want to go out into the world and see a real person again.
Yeah, totally.
anyways, everybody, thank you for watching. If you are not signed up for our newsletter, you can catch the link in the comments below. If you're not following Birth and Baby Talk on Facebook or Instagram, head over and do that. If you are here from our Toronto audience, make sure you're following us on Facebook and Instagram as well. Ottawa, Hamilton, all the same. And Michiko, happydownthere.ca is your Instagram handle. So everybody can find you there and keep in touch for those tips that give. And I'll see you in 2 weeks.
All right. Thank you so much.
Bye, everybody.
Bye. Bye. See you in 2 weeks.